Welcome back. You're still watching Good Morning Namibia. Now, understanding cosmetic dentistry as is not just about creating beautiful smiles, but also enhancing quality of life, self-image, and even social interactions. We're now joined in studio by Dr. Ishmael Banda, a dentist from Wholesome Dental Practice, just to talk to us about cosmetic dentistry. Doctor, good morning to you, and thank you so much for joining us.
Thank you so much. Good morning to you and good morning to our Namibian viewers and also the international viewers. Because ahead now we are streaming live on all social media platforms.
On our
Thank you.
NBC Plus app, of course, and also the website. But how would you describe cosmetic dentistry from your professional perspective?
Cosmetic dentistry from a professional perspective, it is both a science and an art that actually involves the improvement of your aesthetics, especially for your smile. It is not only about making your teeth look beautiful, it has far-reaching consequences. Like you rightly said, it can boost one's confidence. And also the improvements that are instituted, normally we make sure that they are structurally sound and functional. I think that's cosmetic dentistry in a nutshell.
All right.
Yes.
Would you say this is good and bad at the same time?
It is good. The bad part, I wouldn't want to say it's bad.
Okay.
Yeah, but there are pros and cons for every procedure.
All right.
Yes.
Perhaps before we get to the pros and cons, what would you say are some of the most common cosmetic dental treatments that are available right now that people actually make use of?
Thank you so much. I think that's one of the most asked questions. Actually, the most common procedures is your teeth whitening.
Yeah.
Yeah, what we call bleaching. I think this is one of the most sought after cosmetic dentistry treatment. Then from there we have got your veneers. These are just tooth-colored like dental shells that we stick them on top of your teeth
Yeah.
to both actually improve the size, the shape, and the color of your teeth. Then we've got other procedures like what we call gingivectomy. Maybe in a simplistic term is just contouring your gum. Yeah, some people, they've got those gummy smiles. So you need to
reduce the gums?
Yeah, exactly. Yeah.
Okay.
Yeah, so that is one of the procedures that we do. And you've got your crowns, which help also in the shaping of your teeth, also to improve the size and the color of your teeth. And for some of the people who are having missing teeth, you can have implants. You can actually even put your bridge work, to replace the missing teeth. And you would be doing that for functionality purposes, but eventually also it improves the aesthetics.
Yeah.
So these are some of the catalogs of treatment options that we do when it comes to cosmetic dentistry.
All right. And I
Yes.
think some of those examples you mentioned the cons of them, teeth whitening,
Yes.
also just fixing the teeth when it comes to the size, and also just reducing the gums and all that when it comes to self-image. But what are some of the cons? And
Yeah.
perhaps some of the long-term effects? Perhaps like with teeth bleaching, would you say it decolorizes in the future?
Okay, let's talk about the pros, then we'll talk about the cons.
Yes.
Because I think there are always two sides to the coin.
story, yes,
Yeah,
of
exactly.
course.
Yeah. We'll start with the pros. Yeah, obviously with the cosmetic dentistry, it helps boost one's confidence. And you find somebody is now self-aware and is comfortable about their self-image. They become outgoing. Even professionally, they are willing to take some of the opportunities that they might have been scared to avail themselves.
Of course.
Yeah, so these are some of the pros of cosmetic dentistry. And also we talked about some of the treatment, they help to actually improve the functionality. And on top of that, if you can take care of how you look, obviously you will be able to take care of also of your oral hygiene habits. Yeah, so it also improves your oral hygiene habits. Then the cons, we talked, the cost is one of the things that people always complain about. These treatments, sometimes they don't come that very cheap.
Okay.
And also there might be complications like any other medical treatment. you know, like if you are doing your bleaching, you end up having sensitivity of your teeth. And sometimes actually the nerves of the teeth can be damaged. And also with all medical procedures, there is a risk of infection and other complications like treatment failure. Yeah, these are the cons probably that you need to be well aware of, and we can discuss
Yeah.
if you want to get this treatment done. And also the long-term implications. Yeah, you know, you need to know how to maintain these things. Yeah, they don't come cheap, and they don't stay there without proper maintenance. And also the maintenance plan might be actually even more expensive for one. Yeah, so these are the things that one should know. Yes.
Doctor, from your observations, does medical aid not cover some of these cosmetic procedures?
Yeah, some of them, yeah, especially bleaching, the medical aid doesn't cover because I think it's for those that wants to have these Hollywood type of smiles.
Yeah.
Yeah, so medical aid is about sickness. Yeah, but the crowns and bridge work and your veneers, actually, they can be justified medically to be covered by the medical aid.
All right.
Yeah, because these ones, they not only improve your aesthetics, they also can actually benefit structural and functional. Yeah, so you find the medical aid does cover some of these procedures. Yes.
Earlier on, doctor, on some of the cons you mentioned that nerves can be damaged. Can that also perhaps cause to the teeth falling out?
Not really.
Okay.
Yeah, it might lead to other complications and other treatment plans that might be necessitated because of those damages.
Yeah.
Yes.
All right. What should individuals keep in mind, doctor, before deciding to undergo cosmetical dental treatments?
Yes, that's a very good one. I think one, you need to understand the cost implications. You need also to understand the goals, the expectations, because you know with cosmetic dentistry, it is all about expectations.
Yes.
Yeah, some expectations are too much unrealistic, and that needs to be actually managed, and we need to have a proper chat and a thorough consultation with your oral health expectations.
Yes.
Also, we were talking about cost, and these are the things that one needs to know, and also what does it entail, the procedure. You need to understand that.
Yeah.
And also the long-term implications and the maintenance plan that we were talking about. All these things need to be put in one basket, and you need to get somebody to know and understand before they consider cosmetic dentistry.
All right.
Yes.
You have those that would perhaps try to put matters in their own hands, you know, seeing that perhaps they did all the consultations they needed, but they cannot afford it. And you have so many people who are selling teeth whitening products nowadays, or perhaps those that we basically just find in some of the shops. From your perspective as a dentist, would you recommend people take matters into their own hands to find perhaps some of these products that whiten people's teeth, or perhaps just go for cheaper options when it comes to surgery?
That's a very good one. Of course, cost has actually brought a lot of these funny treatment options and treatments that you find at the backyards. I wouldn't really, I'm a professional, and the only thing that I would encourage, and that I will always encourage our people and our clients, the best place to go is to go to somebody who is a professional.
Yeah.
The backyards treatment plans and options, we don't know actually where they are coming from, the dosage, their effectiveness, and how long and how much should one take. And all these things are not known. So you find we have seen people coming with pens in their mouth because of using these backyards treatment options. So I wouldn't encourage that.
All right.
Yeah, if you can't afford it's not always the most expensive treatment that you need to go for. There are cheaper treatment options. If you come, we can discuss, and we can actually be able to tailor make something that probably you can afford. It's not as expensive as people think it is. Yeah, there are always better, cheaper, professional treatment options, especially if you visit those that know, those that are qualified.
All right.
Thank
Doctor,
you.
are there perhaps more natural options when it comes to, let me focus on teeth whitening. Are there perhaps more natural options that perhaps some of the foods people should stop eating that perhaps causes their teeth to become yellow, or perhaps certain type of mouthwash or toothpaste that they need to start using? Just a more natural option than going for teeth whitening?
That's a very, very, very good one. Actually, even teeth whitening, it is limited because of if you continuously eat these colored food stuff, especially your fizzy drinks, Coke, you take these colored food stuff, they tend to stain your teeth eventually. Even coffee. Most of the people that we see, they come with tea stains or coffee stains. So if you want to keep your teeth white and clean, like you said, avoid at least this type of food stuff, which are not healthy for your oral health and your general body health. Yeah, so you find these are the natural medicine, especially the chewing sticks. I think they also help also cleanse and keep your teeth white.
Okay.
Yes.
All right. What advice would you give to someone who perhaps feels insecure about his or her teeth, especially in terms of coloring or bonding?
Yes, yes, that's another one that is so exciting. If you feel you are very insecure, I think the best thing to start from is to know that you are not alone.
Yeah.
And you are not the last one actually to feel that way. So most of the people, they think I'm the only one, but that's not a problem that is unique to one person. So once you know that, you come and visit an oral health expert, somebody who will do a thorough consultation and counsel and give you proper treatment options and plans. Like we said, that is not always the most expensive things that actually can improve one's cosmetic outlook. Yeah, so there are a lot of cheaper, effective, functional treatment options that we can readily make them available to everyone. Yeah, so the thing is, don't keep it to yourself.
Right.
Come and visit the right people at the right place with the right knowledge, and the right things will be made available for everyone.
All right.
Thank you.
I wouldn't do myself justice if I don't ask you, what are your doctor's orders for our viewers this morning regarding cosmetic dentistry?
The doctor's prescription for today, I think we always say twice a year for consultation.
Yes.
Even with cosmetic dentistry, if you follow that, we should be able to pick any other cosmetic dentistry related issues earlier, and we will be able to institute any treatment measures that are needed. I think that's my prescription for today.
All right. Well,
Thank
Dr.
you.
Banda, it's always a pleasure having you in studio. Thank you so much for talking to us.
Thank you.
All right. We heard it right there from Dr. Ishmael Banda, who is a dentist, talking to us this morning about cosmetic dentistry. Well, before you actually consider this, do as much research as you need. Also visit your dentist and ask the appropriate questions. And the cheapest option is not always the best option. More conversations coming your way. To stay with us.